people kind of what we're doing. So yeah, we're recording now. So this is our project here to build a team to bring empathy circles into healthcare. And so we have the agenda starting off with introduction. I'm going to mute you, Divya. With introductions, just say a little bit about yourself, your name, where you're located, and why you're interested in this project. And then we'll go through a review of the project. We have a website. We'll go through different steps, different parts of the website, and then do a sample empathy circle, and then a debrief about the next steps. So to begin with, oh, great, there's Stefan. So to begin with, I'll just introduce myself. I'm Edwin Rutch from the Center for Building a Culture of Empathy. I've been working on the topic of empathy for about 12 years, been really intensely trying to, doing a lot of different projects on how do we build a more empathic culture and society. And I'm located here in the San Francisco Bay Area, just north of Berkeley, a little suburb called El Cerrito. And maybe just why you're interested in, taking part in this project. And my interest is, I really think empathy is just really critical for personal and social well-being. So just trying to do everything I can to sort of spread empathy and empathy practices in all different situations. And especially now since Stefan contacted us about empathy in healthcare, I feel that would be a really great, good contribution to support healthcare workers with mutual empathic listening. So Bill, do you want to introduce yourself? We just go around and everyone introduce themselves just shortly.
My name is Bill Phil. I'm a retired special education teacher. I also worked in psychiatric hospital as a director of education. And I've been working with Edwin for about 2 years. I've been very impressed about how this process really leads to an opening and lowering of defense, people being defensive. And, I'm looking to also spread that. I feel that for a number of levels, empathy is very important at this point in time. Thank you.
Oh, thanks, Bill. And Jasmeet?
Oh, yeah, so my name is Jasmeet, last name is Gill. I was doing a 1-year externship for the past year with Dr. Carlson and the rest of the attendings at Brookdale. I'm really interested in psychiatry. I just moved to Detroit, Michigan to start residency starting on July 1st. And I'm really interested in empathy is because I know empathy is a big part of psychiatry, and I want to kind of learn a little bit more about how these circles work. So I wanted to join you guys today.
Oh, great, thanks. Charles?
Hi, so I'm a medical student in Quebec, and prior to my medical studies, I did a master's on empathy as part of sociology. And so I've applied that. I guess it gave me an eye for empathy in an institutional setting. So I've applied that to the institution of medicine and hospitals. And so now I've been giving talks to healthcare teams about what is it that either erodes empathy or cultivates it, how we can build from what we have and prevent compassion fatigue. So obviously I've always been quite keen to work with empathy, and I've heard of Edwin, of your work. Since I began that master's 8 years ago. So it's been a long time, but it's the first time that we actually are on.
Thanks to Anita for introducing us. Yeah.
Mm-hmm.
Well, great. So great to connect with you. So Neetu? Oh, you're muted.
Sorry about that. Hi, I'm Neetu Atwal. I'm a former extern and prospective psychiatry resident. I am also interested in empathy circles as what it could bring into how I could bring it forward in my career, and then also want to learn about how to incorporate it into my daily life and how it can contribute to the COVID-19 issues.
Great, thanks. Marta?
Yeah, hi, I'm Marta. I'm based in Cork in Ireland. I'm a final year PhD student here. And I met Edwin through Extinction Rebellion, so an environmental group that I'm an activist with. And so really for me, it's the climate crisis has a lot of difficult conversations that need to happen and that worry me. And so I see empathy and empathy circles as a brilliant platform to have difficult conversations and to build community. So yeah, very interested in see how we can support health workers in that context as well.
Oh, thanks. Divya?
I am Divya. I'm an international medical graduate from India. I was doing the externship with Dr. Carlson a year ago at Brookdale Hospital, and I'm going to be starting to do my psychiatry residency in July at Brookdale Hospital. Initially, when I came and joined the empathy circle, it was more to contribute in some way for the COVID crisis that was going on. But now it seems that this empathy circle will actually make me a good psychiatrist as well. It's going to help me help people use empathy as a key factor in their life and actually solve their problems. So I'm really looking forward to it. Thank you.
Thanks. Stefan? You're muted. There you go.
Okay. Let me be present now. I have a million things going on here. Thank everybody for joining. This meeting is intended to be a planning meeting for how to implement the empathy circle, particularly at one hospital in Brooklyn, New York, or a group of hospitals, 3 hospitals. And then at least that's my vision for this meeting. Edwin shares that vision. And then, of course, down the road, we could spread this practice once we have some data and results. Of course, we all personally have conviction that it has, personally, anecdotally worked for each of us here who are participating. What we found is in disasters like this one, some of the most important things for healthcare workers, who are the most vulnerable population. All of the research out of China demonstrates that healthcare workers, particularly female healthcare workers, are the most vulnerable to COVID, not to the psychological sequelae of COVID-19. And we need a scalable intervention, which can be and ideally used on a platform like Zoom or GoToMeeting, for example, that can do a couple things. It can give a sense of connection, collective action, allow people to feel validated, heard, allow people to be self-aware of their emotions and emotions of others, and create a sense of we're in this together, instead of our more evolutionary standard response of me, let me save me. And so that's how we came up. That's how Edwin and I started coming together again to think about implementing the empathy circle. And so we've started to do that, and it is slowly moving, but I have to continually continually cheerlead for this. Even in my own organization, there are a lot of roadblocks, and and for many structural, cultural, reasons and such. And some of the most common ones are, that it'd be selfish to take time for myself. Others are working hard, so should I? I'm okay. I'm fine. That's for somebody else. I'm doing enough. I can contribute most by working all the time. I don't want anyone to know how affected I am. Only I can do X, Y, Z. These are just some of the multiple reasons that I've heard. And but what we know is that this is a marathon and not a sprint. and that people can't keep that up. Otherwise, the toxic stress will pile up and lead to significant things like suicide, PTSD, and other psychopathology. So we're trying to buoy people up, enhance their resilience with some different practices, and it'll be a menu of options. It won't be just empathy circles, but empathy circles can be a part of it. And so we've got four people on this call who are doctors who worked with me previously, and it was great to meet Charles. And I don't know who Shannon is. I missed out on who Shannon is.
Oh, we're still doing introductions. We just
sorry.
Yeah,
okay.
we'll continue.
Sorry.
You can pick up as soon as we, share more as soon as we do finish the. So Shannon, would you like to introduce yourself?
Sure. Hello, I'm Shannon Fisher. I am not a doctor, a physician, psychiatrist, anything, but I am actually a COVID casualty. I was laid off the first week that COVID started. Before everyone went on lockdown here in the US, my company, I worked for a consulting firm in the HR space. And was let go early on. So I am friends with Graham Bodie and Pierce Godwin, and they are with the National Conversation Project and Listen First Project. And so I am actually chairing the care committee for the National Conversation Project in a partnership with the Aspen Institute for weaving communities during crisis. And so I think Graham was the one who forwarded me the information for this. And I thought it sounded like, well, first of all, something that I am definitely interested in, because I feel like oftentimes people feel like empathy is something that should be subjective to how bad the circumstance is. And I think everyone can use empathy. And so I'm very excited to be here and to participate in this. And then secondly, I think that it could be something that could be very useful for weaving communities in times of crisis. So happy to be here, and thank you for having me.
Yeah, I'm thrilled that you're here to have a connection with the whole Conversations project that really makes the connection to a lot of different organizations that are really about an empathic conversation between people, and also healing the political, social divides, as well as all the loneliness and things like that, building community. So thrilled that you're here.
Thank you.
Sharman, would you like to introduce yourself, just your name, a little bit about yourself, and
sure,
and why you're interested in this project?
So I'm an international medical graduate, so I have been working in the healthcare for a while, and now I'm looking for a residency. I worked at Brookdale Hospital under Dr. Carlson, and he was the one who introduced us to the Empathy Circle. So I think this is a great opportunity to share my own feelings and also listen to other people's from different, who are from different background, who has different profession. So I'm really happy that I joined in the Empathy Circle. Let's see what happens.
Well, welcome. So I put the agenda in. I don't know if you come late, then you don't see it. But that was the agenda. So I had on the agenda to go through the website that we have. It's just a project website. Just wanted to kind of share the screen, go through it to give sort of an overview. And we're really here to kind of build a team to support bringing empathy circles into the hospital. I guess there's 3 hospitals actually in New York, and try to support them. And then, as Stefan was saying, to sort of spread the practice to other facilities. So let me actually just start. And then we also want, if we have time, to do an empathy circle, do some actuals to experience it. So let me start with giving a little bit of a tour. This is just a quick website that I just created just to sort of hold the information about this project. So we just have our landing page. It's not an aesthetic, public site. It's just more of a place for us to work. We can give you permissions to edit it. And this is just a landing page, so you'll be able to find the information, just some resources. There's some how to take part in Empathy Circle. So, why participate, facilitator training information. when we've had different circles, different meetings, and we, create a web page, for each one. This one, so we have a bit of a record of what we've been talking about, as well as, just sort of a timeline. Stefan and I met with Tanya Singer, who's a big empathy research, and she kind of just gave us some, tips on creating a study. We have sort of an open Friday empathy circle that everybody is welcome to take part in. And it's an open public circle on how to, just for mutual support around the COVID crisis. And then we have a support group that meets for facilitation. Hopefully we can get everyone here, taking the facilitation training. And there's a support group. And here's a video of Stefan, talking about the need for support, and give some more insights into the project. And just sort of various calls that we've had so far. We are now here at the team meeting, and we are recording this, so we will put this video, online here, so that anyone wanting to join the team can kind of get caught up. Then we have a section here for papers. Stefan's been doing a lot of research about papers, and studies and articles related to sort of well-being, for healthcare workers. We have some articles, et cetera, here about empathy and so forth. There's a lot of studies. So whenever Stefan sends me some of those, I post them here too. We have a project to-do list. So hope you're able to see this. It's big enough. So so far is the first task is for everyone to be able to take part in and experience an empathy circle, because if we're trying to promote the practice, we really want everyone to be familiar with it. We'd like everyone to be able to facilitate an empathy circle. You can get some friends, coworkers, and sort of practice the practice. We want to build this team to, specifically see how we can bring this practice into the hospital there, and then we do hold, we have a couple of empathy circles twice a week right now, specifically for the hospital. So anyone can come and join and just mutually be heard. We need to develop some specific empathy circle trainings that are specific to the healthcare. We have some, quite a few trainings that we do for facilitation training, but they may need to be tweaked for the healthcare field. We need to, just find what tasks need to be done and see who wants to take on those tasks. We want to get a cohort of 5 to 8 people together to take part in an empathy circle trainings, and your ideas here. These are some other projects that came up, and each one kind of links to a separate, just a starting page. Stefan wanted to create an academic study about the effectiveness of the empathy circle. Also wanting to write a paper, an article, I guess, about it. I know you were interested in measurements, like how do you even measure the success? And that's a lot of what we talked with Tanya Singer about. She does some pretty high level research on topic. We have a page for the team building. I think Stefan wanted to build the case for the empathy circle, like why the empathy circle in healthcare, which I think Charles probably could really contribute a lot to. Since with having his master's on the topic. Funding, how do we fund this work too, to keep it sort of going? We're kind of all doing, a lot of us in our group are doing it voluntarily. We need to write up a blurb. There's the Oxford Empathic Care Program, and they are specifically for empathy in healthcare out of the UK, and I've interviewed the person that runs that, and he said he would send out an email to hit his whole list. And they've had different conferences on empathy in healthcare, so we can sort of connect to that network, which leads to sort of the outreach in general. There's a lot of outreach we can do. I've done probably about 300 interviews of empathy experts on all kinds of different topics. And there's a whole section on my website, Culture of Empathy, with empathy and healthcare experts. Haven't interviewed Charles yet, probably do an interview with him. And so there's like Helen Rees. There's a program in Australia, the Empathy Initiative. There's this author, Brian Goldman. He's been interested in empathy in Canada. He's written a book about it, and there's a Compassion Connection. So there's a whole bunch of different people that we can reach out to. So that's Helen Rees. She does that program, Empathetics. So she's a psychiatrist, you know, well known, and I've done interviews with her. These are some of the people who I know of in the field. So I've been just kind of, you know, casting a net. Who can we reach out to that might be supportive? Mm-hmm. I've connected with everyone. I know personally, you know, talked with everyone except the Cleveland Clinic and the there's another center in Denny Stanford Institute for Empathy and Compassion. They're out of San Diego, University of California, San Diego. So there's all these other authors. And then there's a kind of an accessible to-do list. So you can access this to-do list and, you know, add ideas, comments, you know, what kind of tasks you like to work on. And you just click there and it opens up a public, you know, that you can edit. I can also give you edit permissions for this website too. There's various references, you know, there's just some videos that we did that some emails that Stefan sent out just so you can see what those look like, announcements. And we can put together a team list, and that's kind of the gist of the website. That's kind of like the framework, you know, for the team building. So yeah, I don't know if any gives, Brian Goldman gives opening plenary for Canadian Conference on Medical Education. Okay, so that was from Charles. So I don't know, Stefan, do you want to add to that before I thought we would just kind of give us that sense and then actually maybe divide into two circles and actually do an empathy circle on the question of, you know, how might we develop this group, and maybe for about 45 minutes or so. So do you want to?
So along the same lines, you know, we thought that for the collection of the people, particularly in the healthcare system, we're going to have a separate database. So we're creating a website which is particularly for the healthcare workers to control. You know, the overall contacts, and that those would, and then we were going to use something like Constant Contact to, you know, get those names, and then, but that can't, the full extent of that can't happen until we have a IRB proposal approved under, you know, emergency waiver, but. You know, so I mean, the way I'm formulating it is we're really trying to, with the Empathy Circle, create a resilient organizations, resilient healthcare organizations, and so that's the theme. I think that's the best to put forward. I've also reached out to to Berkeley's Interdisciplinary Center for Healthy Workplaces. And been in contact with their executive director, Christina Banks, and she's put me in touch with a researcher and a guy in Texas who has put together a online resilience program, and he is going to contact me and see how we can, you know, work together. There's a So why focus on this hospital, for example? Why, you know, everyone you know, needs help. Okay, but if you read in the New Yorker, there was a recent article called The Black Plague. And in that article, it talks about, the racial structural and institutional racism, and how they have led to, African Americans, for example, have much, much higher rates of comorbidity of diabetes, asthma, hypertension, cardiovascular disease, you name it. So that is caused. Then there are all the other social determinants of health, such as lack of housing, insurance, and so that's the community. That's the community where the 3 hospital systems are that I work in, which are safety net hospitals. So this is what we're going to see when the federal data comes out, which they have been very cautious about publishing the results of. Only I think 3 states or so have published some early data, but in most cases, 70%, in most states, 70% of the people that have died are African Americans, while African Americans only account for 9% of the population. So just looking at very, very dramatic numbers. And so my 3 hospitals, for example, so what you're looking at is you're talking about Philadelphia, Chicago, parts of Baltimore, Brownsville. These areas are where significant deaths are occurring disproportionately in African American population. So what needs to occur is just professing that we know about this disproportionate effect. That's not good enough. What we need is real action. Like we need money, we need resources, and so the empathy circle is not a panacea, but it is one piece of this puzzle of trying to provide a process where a lot of anger, anxiety can be dealt with, can be managed more effectively in a peer-to-peer process. Much like there's another website that I became familiar with recently called Peer Reaction. Remember the exact title of it? It's not coming up for me right this second. It's called,
Peer
you remember it, Nitu?
Peer RX Med.
Yeah, Peer RX Med. So that's it's of the their website is kind of right target with a similar kind of thing that we want to something simple, but it's the way they advertise theirs too. It's free, scalable, peer-to-peer, very similar to like the Empathy Circle. Of course, we're biased towards the Empathy Circle, but many of these different processes potentially beneficial. So I mean, there's a lot of things that need help, and wonderfully wonderful. It's so wonderful that Edwin is just so organized, and he can and presented all these different things that we are working on. But so we need to grow up. We need to build our facilitators. We need to we need an organizational kind of psychological perspective on how you get this to take uptake in an organization. And then we need champions, we need buddies, we need grassroots, we need QR codes, we need all kinds of different technologies and concepts, and Cotter's 8 stages of organizational change and all these. So like, Cotter's thing is you need urgency. So we've got that, COVID-19. You need somebody who's trusted. You need somebody who can tell a story. You need someone who, on and on. So these different 8 stages of change. But because all of this right now is happening in a healthcare field, which up to now has held all of this technology, all of this change has been blocked. And suddenly it's being forced upon medicine. People don't realize that medicine is very, has a great challenge, is very antiquated in its approach to change. But it is having to adapt now very fast. So that's kind of just a broad overview, and I'll stop
that's
talking
great.
now.
Yeah, so what I thought is maybe actually we could go for about almost an hour with the empathy circle, and if you need to drop out during it, that's understandable if you have something urgent going. And then we'll come back and we'll just report back kind of ideas that we had. So the question is what ideas do you have for developing this team and this project? I created 2 rooms, 5 people each. I will facilitate one. And Martha, are you still there, or are you hearing us, or Bill, or either can facilitate the one? Bill, do you want to do the second one? And we just take
like can I say something?
Yeah.
I really, well, ideas are fine, but I'm not really, at this point, we have enough ideas.
Mm-hmm.
We need some people to agree to take on some different tasks more. We need to find a way to divide the labor. That's part of what we need to do.
Okay, so the question is, what task would you like to take on for developing the team and the project? Does that sound like a good question? So is everybody here familiar with the empathy circle? Have you seen the practice, or should I give a quick primer? So a quick primer. Okay, it's a very simple practice. There's a speaker. Someone will, let me just mute somebody here. So one person will speak, and you'll select who you're going to speak to, and you'll have up to 5 minutes to speak on the topic. And you share a little bit, an idea or two, and then you pause and you let the listener reflect back their understanding of what you have said. So that's active listening, empathic listening. And then you check, did they accurately understand what you said? If they didn't, then you kind of say it again. In other words, you want to just be sure that the person understood you to your satisfaction. If they did understand you, you continue, sharing some more, and then you pause and you get a reflection back. And then you keep going for the time allotted, 5 minutes. The facilitator will, hold up a sign or something that says, 5 minutes, your time is up. The others who are the silent listeners, you can maybe take some notes if you'd like, and so further reporting back. And then once your time is up, or you feel heard, if you just speak a couple of minutes, you don't have anything else to say, you can say, oh, I feel fully heard. And that means that the listener then becomes the speaker. They select who they're going to speak to, and they do the same speaking until their time is up, or you don't have anything else to say, and then it just keeps rotating like that around. So this is if you're for the people here who are therapists or psychiatrists, it's basic active listening, empathic listening, but it's not in a client-therapist relationship. It's peer-to-peer, mutual empathic listening, and I find it one of the best. I find it is the best empathy training that I know of. So we can argue about that later. So that's my view. So I guess we're ready to go into the circles. The best thing is just to see somebody. Did I lose somebody here? Oh, there we go. Okay, we have 2 circles. Bill, you'll facilitate and do the timekeeping, and okay. So we're ready. And then we have what is that? About 50 minutes for the empathy circle, and then we'll come back and just report back kind of what tasks are you willing to do to develop this team. So and also the empathy circle, we like to have 4 or 5 people in a circle. That's why we're dividing into these groups. So you can click and it'll take you into the room where you'll go automatically in a minute. Okay, I can keep time if someone would like to start. You can maybe speak to me just as an example, to get a sense of how it works. I can model it. So our question is like, what tasks do you have that you'd like to take on for this team, or take it away? Who would like to start?
Jasmeet's never done it, right? So
So do you want to
Sharman,
start? You can
yeah,
start, and I'll just reflect back. I'll model it just for, yeah. Go ahead. So you just start speaking about whatever ideas you have and for the on the
Sorry,
topic. Oh, Sharman,
yes. Hello?
Yeah.
Can you hear me?
Yes, we hear you.
So the discussion will be about like how we can improve the empathy circle, or
No, how
what's
we
the topic
can,
like?
the topic was what task would you like to take on for this bringing empathy circles into the facilities, into the hospitals that Stefan is managing.
Okay. So, I mean, at this point, what I'm
Sharman,
doing,
who are you going to pick to
hello?
talk to?
She can speak to me.
Yes, I'm
I'll
speaking
model
to
it. So
Edwin.
it's
Yes.
good to, because nobody else maybe knows quite how to do this. I don't know, but yeah, so I'm listening. So, yep.
Yes, I'll pick Edwin.
Mm-hmm.
So I mean, I'm thinking to expand this empathy circle. I already invited some of my friends, some of my colleagues who I worked with before through the Facebook, and also, I mean, whatever app I use, to be honest, like WhatsApp, Messenger, and also there is another one I don't use, but I'm trying to spread the concept. But seems like everyone is very willing to participate and also contribute. But the only common problem they are sharing with me is the time commitment, to be honest, because everyone is sitting at home. They have to juggle between a lot of works, especially who have kids. They are facing a lot of difficulties.
Okay,
I'll
well, let me
stop
have a
here.
flick back. Yeah, thanks.
Mhm.
So what I'm hearing is the way you would are trying to contribute is to sort of reach out to friends and colleagues to get them involved. And you're just sharing your experiences. You're running into some challenges that the people you're reaching out to, they have sort of time challenges. They have kids, they have this, there's a sort of, they don't have the time, sounds like.
Exactly. And some of them suggested, like, is it okay if we join for only 20 or 30 minutes and then we leave? Is that okay? And they're kind of like confused. I mean, like, if once they participate and if they are not able to continue, because they were asking me how long it's gonna continue. So, I mean, I think even if there are so many people around who wants to participate, but because of these kind of challenges, they are willing, they're not able to participate.
Yeah, so you're just sort of naming the challenges that people might be willing to take part, but they can't for various reasons. Plus they have questions about it, like, oh, how long, what's the commitment level? So It's just kind of articulating the challenges that you're hearing.
Exactly. And some of them, I mean, they are not working right now, but some of them who are living in New York, so they're hearing that soon, I mean, all the offices and all the hospitals, I mean, they will be opening some positions and they'll get busy maybe after a month or two. So this is something also like preventing them from joining, because they're thinking, we don't know, we may have to go back to work anytime. And this is kind of like a place that where we need concentration, we need to listen, we should be there. I mean, we cannot just pretend listening, we have to be there in person, to be honest. So these are some constraints, I think.
So another constraint is some people say, oh, I might be called back or get a position in a hospital and I'll have to focus on what the needs are there. So I can't be sort of involved in something like these empathy circles or whatever. So that's just another constraint that you're seeing.
Yes. I think the big challenge is a time commitment, to be honest. So I don't know if you have any plan on that. Like, I think, I don't know how it will work, but maybe half an hour is doable for some of the people. So maybe if you can share some ideas with us, like how we can do it. Because most of my friends, they're working in the healthcare and they're really very busy.
Mm-hmm. Yeah, so people are just really busy in the healthcare field, like, oh, they could maybe do a half an hour, but, you know, so you just would like some ideas about how to really address this time constraint.
Thank you. I feel fully heard.
Okay, great. Then I'll speak to Stefan. Are you available, Steph? There you go.
Yes.
Yeah, I do notice the time constraint. I'm feeling the energy of the time constraints. You know, I feel the vibe. It's like usually with the empathy circle, I like 2 hours for the circle because it really takes almost an hour for people to kind of move through, you know, to get to something deeper. So that's why we usually do like 2 hours for an empathy circle to kind of, for people to really start connecting at a deeper level. So. And I feel it viscerally too. Seeing you, you know, see that there's, I find myself talking faster. You know?
You know, your experience, you know, in these moments, you felt it in your body, this tension, maybe in your muscles and other places in your body, and you're hearing this feedback, you know, continuously that you know, this traditional idea of using 2 hours, which really allows people to settle in and get it more meaningful, deeper, authentic participation. You know, is you know, possible. It may not be possible, or at least it's you know, you're seeing right here in the moment that you know, that it's the ideal, but it may not work, and so you know, that's the gist of it.
So I'm really thinking, like, for people who are in high stress, just being heard is helpful. Like, oh, you're stressed, let me listen to you. You know, if I'm well resourced and I have space, that's a real contribution for people, sort of like a therapist or counselor will do to someone. So that's like part of the empathy circle, that's just listening. But it's like kind of having time and space to kind of do this mutual, I can see is perhaps more of a challenge in the healthcare, in a high stress healthcare field. But I think it is really needed. I think people need to take that time.
You're feeling blessed that you have time and resources to take care of your wellness, and you also believe that time and resources is what is necessary for others to take care of their wellness, and the people who are best situated to give in these times are those people who have more time and resources to you know, to have something to be generous in doing the empathy circle.
Yeah, so to do empathic listening. So I do kind of think of like how to bring it in, because it's like when the crisis happens, it's like you want to have been well resourced beforehand. It's like, you know, these practices should be taught in med school, or even in college, or even in grammar school, or, you know, I mean, way back. So you would be well resourced when this crisis happens, but all that hasn't happened, right? So it's like, here's the mess. Here's a damn mess. The society hasn't addressed this. And now, you know, how are we going to clean it up? And I'm willing to do the work at kind of, you know, shifting the culture to a more empathic society. But it's a challenge, and I think a challenge can be addressed. You know, that we can overcome that challenge, and you know, that's what we're working on, is finding the ways to bring, you know, a more empathic way of being into these different cultures.
In an ideal world, you know, we would have trained up our children from you know, birth to now to be prepared to deal with this disaster right now. But angrily, you're angry. And
been pissed off about it. It's like, come on, culture, what's going on here?
that didn't happen. And
Yeah.
but your anger is empowering you to move to action and to do everything you can within your abilities and your network to try to bring empathy circles and teach people how to use them to improve their wellness.
Yeah, into the whole culture, but, you know, specifically into the culture of your hospital too.
The culture.
Yeah, I feel fully heard.
All right. I'm sorry, Charles, may I speak to you?
Yeah, absolutely.
Okay. So today I am feeling particularly fluttered, or I said right now I'm supposed to be on 3 different meetings, or in 3 different meetings. I was supposed to be taking part in a mindfulness meditation, and I'm also supposed to be on a call with nursing leadership to institute some new processes in the hospital. I think I've slowly, as we've got into the room, kind of finally settled down a bit. But I am feeling this kind of need to be busy right now, and all this anxiety, and like I bet other healthcare people and people who are not even in healthcare.
Yeah, that makes a lot of sense. So if I understand you, it seems that just there's quite busy days, and so even now as we're meeting, you're in the midst of, or in between other meetings as well, and even this time you're giving us now is in a sense, I wouldn't say compromise, but you feel, you know, you feel there's a lot going on. So is that making sense, that what I pick up from this is you could use yourself certainly some self-care, and I'm seeing a lot of self-empathy as well. Of course, I'm curious how you
You can just reflect. Yeah, just don't want to ask any questions. Just let him speak and
no
reflect.
Questions.
Yeah.
Great. So that's what I understood.
Mm-hmm.
Okay, so that's part of it. What was part of also what I said, part of the meaning of what I was saying is that I chose to be here. Okay, I had 3 other meetings. I didn't say that, but what the message was in my communication was that I had 3 other meetings that are supposed to be going on now, and I chose to be here at this time. So there's a lot. That's a lot wrapped in that statement.
Wow. Yeah, that makes that's true. I had misunderstood that, so thanks for clarification. Yeah. So thanks for choosing thanks for choosing this.
No, just reflect back what he said. You don't need to comment on it. Just what did you hear him say?
That Stefan chose amongst all of these engagement, it is it's quite a meaningful statement. He chose to be here rather than some other engagement. Yeah.
Mm-hmm. So ultimately, the empathy circle is it works in many different levels, but it is an ultimate act of self-care and self-compassion, and healthcare providers are particularly challenged in this area of having self-compassion. But what the early research shows, such as out of Kristen Neff, who's I think he's out of Stanford. She has written a book or several books now, and she has scales and measures on self-compassion, and healthcare workers tend to do very poorly in this area. All of us have much work to do. Most of us are very harsh on ourselves, very judgmental, and all of that gets worse in any kind of traumatic situation, because we tend to, and I do too, we tend to blame ourselves for much of what happens to us.
Okay, sorry, I think there's a delay sometimes with the video and the sound. But I understand that this is what you meant to say. Otherwise, I'm sorry if I'm interrupting. Just let me know if it's a technical issue. But I understand that the way you perceive this and this is quite an act of self-empathy and compassion. So this time that you're devoting is also a way to self-care. And that this is also something we need to undo, is that this is not a culture where this is promoted or valued, or it is not socialized into the healthcare workforce then to have this self-care. And this is something we need to work, from my understanding is you feel this is something we need to work at and find a way to change.
Yep. And it's my time, so I'm going to stop there.
Okay, great.
Thank you.
Yeah, so Charles, now you select who you want to speak to, maybe Jasmine, since he hasn't spoken or listened yet. So
Yeah,
you
sure.
have 5 minutes, and I'm keeping time. I'll put this up when the 5 minutes is up.
Okay, great. Thanks, Edwin. Thanks, Jasmine, too. So what should I say? Well, on the first, just me being here. So I was a bit in and out of the conversation, wasn't there in previous meetings either. And even this meeting today, wasn't sure what would be the expectations. So there's a part of me that, of course, is in between. What can I offer, and also, is that something that I can or that I should offer at the moment? For example, there's always I'm in a few groups where I work mostly with people in the US, and sometimes what comes up is that the support coming up from Quebec doesn't always translate the same in a different country or in a different setting, or etc. So there's always that question of what help am I allowed to provide. And the second one that is on my mind is also, as I said, should I or to what extent can I be helpful? As one of my concerns lately is having had the COVID myself and been maybe delayed in a few projects and work that I spearhead, is also things that accumulate and that I'm trying to keep on top of. And this is also something I need, a balance I need to figure out.
And so basically, the response that I'm giving is, you said they're not comments, Edwin? Or
oh, yeah, you're just reflecting. What did you hear Charles say? What did he say? Did you hear him say in your own words?
So basically, what I heard him say is he's feeling that he's not sure of what.
What is Jasmine? Jasmine, don't talk to us. Talk to.
Oh, okay. Talk to Charles. Okay, so Charles, basically, what I kind of heard you saying is you're not sure about how much your contributions to the project can be at this time, because there's a lot of things going on in your life with work and, with different projects you have going on at work. And after you just got done recovering, or in the process of recovering from COVID, it could be difficult to, take on all these different things at one time. And also you said being in Quebec, where it's a little bit, the culture is a little bit different. It's hard to sometimes, sometimes it's hard to connect with the people that are in the United States. I kind of heard that, and other than that,
Yeah, and then you just continue. Charles will continue. Go ahead.
oh.
Okay, yeah, thanks a lot. I feel that's a good understanding for sure. Even it's hard for me to frame myself into into words, right? So, but yeah, so that part about Quebec, I think it's mostly just to what extent my help can be appreciated in a different, whether it's institutional setting or activities, or if it would have been I don't know. I think it's just something that needs to be clarified, is how I can be helpful, and that this can be translated, because maybe I'm not in the same setting, but I think you understand pretty well. I feel quite heard, fully heard, I'd say.
Okay, thank you. Yeah, and going along with what Charles is saying, it's my first time also being here.
Now you select who you're going to speak to.
Oh, okay, now okay. So I can select. How about I'll select you, Edwin.
Actually, Charmin hasn't reflected anyone. If you want, it's your choice. But
no, for sure. Okay, so I'll I select
Yes.
Charmin.
Okay.
So basically, let me just think for a second.
You're trying to think for a second.
Okay, so I'm grateful that my family is not sick. Grateful that although a lot of people are sick and suffering at this time, there are way more people that are recovering from this illness. So I woke up feeling grateful that me and my family are feeling good and not sick. Also, since I'm a new member, I don't know, I'm not sure of what contributions I can, make to the circle. I'm trying to still, after maybe having our first meeting today, I can maybe think about some of the things that I can contribute in my, schedule, and, different ideas that I can come up with. And and I'm grateful that even sitting in our homes, we have things like internet connection and computers to stay in touch with each other and our loved ones through things like this, like the Empathy Circle.
Okay. So you are paying gratitude over the fact that, based on the current pandemic situation, where many people got infected with the COVID, and also some of them are recovering, but your family members are still not affected, they're in good health. And also, since this is your first meeting in the Empathy Circle, you are trying to figure out how you can contribute in the circle. Also, you are thankful to the social medias that you are able to connect with the people you're close to. You can reach out to your friends using those social medias while you are homebound.
Yeah, perfect. I think you heard me perfectly, Sherman. And, including the social media, like I recently had this meet and greet with, the new residency program that I'm going to start at. And we had talked about, I had brought up, they were asking me what I was going to do this next week. And I had brought up to everyone, the residents and the program director, that I'm going to be joining one of my older attendings and some of my older colleagues in a Empathy Circle. And everyone was really, really, really intrigued by the idea, and they wanted me to participate and let them know how it went, so then maybe they could join and join us for a future Empathy Circle meeting. And so I was really excited to join you guys today.
So you are stating that you conveyed the essence of the empathy circle to the program directors and residents of the residency program you are going to join, and they were really fascinated about the empathy circle. They're willing to join, and you are hopeful that they'll be joining and will be getting some benefit from it.
Yes, definitely. Yeah, I think you got that. So is our 5 minutes up, or is it still
You have a minute and a half, so you can
Okay.
say you're fully heard, which kind of passes the turn on, or you can continue for
Got it.
about
So I think overall, Sharmit has fully heard what I was saying, and basically, I'm hoping that I will be able to, contribute to this group and bring other of my friends and colleagues to join the group, so we can get more ideas and further, make some progress.
So you feel like you are fully heard, and you are trying to include more and more people from the residency program. You're planning.
Yeah, definitely.
Some more ideas how to make it more effective.
Yes, and that's thank you for hearing me, Sharmit. Appreciate it.
Okay, sure. I don't know. I mean, can you all hear me?
We
because
do.
Some of yes.
Sometimes
now
there's a little static, but
yes.
yeah, I do hear you, and so it's your choice who to speak to.
Okay, I will speak to Charles.
Please do.
Hi. So I'm at this point, I just want to share some other feelings I'm going through. I just recently heard about a tweet of the president that he's planning to stop the immigration or something. So I do have some of my relatives here, so who are planning to apply for green card citizenships or something. So at this point, since I'm homebound and we are in a lot of interaction with our relatives, on the top of the COVID situation, this kind of thing is really making our life more stressful.
Yeah, so thanks for sharing that. What I hear is that right now already the situation with COVID, with being homebound, all of this is already exerting some pressure on all of us, and of course on you. But additionally, the fact that it's been recently in the news, Trump has vouched to stop immigration in the U.S. So this is raising new anxieties or worries specific for you, considering your family. You have family that was planning or is applying for immigration here, and
yes. And some of my neighbors also, actually expressing their concerns. The other day I was taking a walk outside, and of course I was maintaining social distancing, but they're also worried because they have their relatives too. So I don't know, I think, many people will take it in a different way. But I hope that, I think, I don't know about what will happen in future.
Oh, so maybe your connection. Sharman, are you still there? Oh, maybe if you, I think it might be bandwidth, Sharman, if you turn your video off. Do you still hear us?
Okay.
Yeah, if you turn your video off, it might give you more bandwidth because you broke up there.
What just happened?
It's just a little cut. Just you were mentioning your relative,
Okay.
like the neighbors, and well, maybe I can summarize what I heard, and then you'll know what I picked up. And so what I understand is, and beyond, you know, the pressure that is on you of being in that state of having family, there's just, I think, a bit of a social context. But do you hear me at the moment? Just want to
Yes, I can hear you. Yes.
Okay, sorry, wanted to make sure about
Okay. And also some of my friends, I heard that, I mean, there are lots of layoff going on from the jobs. Many people are jobless. I mean, especially I live in Seattle. I have never seen so much homeless before. So now I can see lots of homeless people surrounding me. So this is kind of like really making me, I mean, worried about what will happen in next couple of, not months, actually years. I don't know what will happen. And also I heard that like the COVID-19, it doesn't give you lifelong immunity. It can reinfect. So far, the scientists are telling. So I'm really worried about the future, like what will happen. That's it.
So clearly, beyond your immediate, you know, circle and concerns, there's clearly a social dimension. There's concern that this is going to have that this is having a broader impact, right? But also a lasting impact on just the community around, whether it's the neighbors, your friends, regarding the community that you're part of, but also the people that are homeless. It's just a broader concern that rises some concerns, maybe anxieties, and even regarding the end of this whole thing, considering if we can get reinfected, if we can build immunity. That's also a lot of unknowns that are weighing on, that you feel the weight of. That's what I'm getting.
Okay, I feel hurt. Thank you.
So you choose who to speak to, Charles.
Yeah. So I think I'll talk to Stefan. We can revert from earlier.
Stefan, your video is kind of frozen. You could turn it off. It might give you more bandwidth. I can turn it off remotely because you're.
I mean, I can do it. Is that better?
Yeah, I think it's better connection there.
Let me see if I can. Okay, go ahead.
Well, I hear you quite well. So then maybe I'll pick up with what Jarman was saying. Just right now, one of the assignments, you know, they're asking us to do, and because I'm also doing my clerkship, but this is all suspended or rested for the moment. So they're giving us all these assignments and teachings in the meantime. Anyways, one of them is a reflection of how this is shaping our practice, and I realize there's so many unknowns at the moment, and so we're learning to be doctors at a time of great, we're realizing our own limits, our own uncertainty, right? So these are concerns that I've had personally, having had COVID myself. For example, I mentioned a bit earlier, well, I'm concerned that we're just waiving the quarantine after 14 days, considering I'm still positive after 23 days. That's one unknown. Transmission that can be just through breathing, right? This another unknown. As you mentioned, Charmin, there's the possibility that maybe I'm not getting immune. Maybe I can get reinfected. So maybe I'll be a bit bolder approaching COVID patients because I feel immune, and then what if in the end I'm not, right? So there's And also I didn't mention, but even the symptoms, classic symptoms of COVID, I think you've all heard of them, but we're realizing that the impact is a bit broader. And so even from my own experience, I had some more acute neurological symptoms with the COVID, which nobody really are mentioning. So I've had.
You may want to pause there. That's quite a bit.
That's
so.
quite a bit, huh? I think I'll pause there. Thanks.
Can you enable my video again, Edwin?
Sure.
You took me off.
Yeah. Just ask to start video. Is this your video?
Let me
is
just
frozen?
try it again.
Yeah. Okay.
How about now?
Yeah, we hear you.
Is it frozen now?
No.
Okay. So Charles, what I hear you is what I heard from you is drawing parallels from everyone that we're in this. We're looking down at this great abyss of uncertainty, and we're all displaying fear and other intense emotions in our own ways that are unique to us, and everyone and yourself are finding in this very moment some self-discovery and some sense of feeling heard, and that's that in and of itself is therapeutic.
Yeah, thanks for the echo of what I said. I feel quite heard. Yeah, it's what I wanted to communicate. Is these are a lot of unknowns to deal with, and the fact that I was experiencing those personally, not only from reading, say, the news or articles that are trying to state whether we get immunization or not. Like there are these concerns, but there's also the fact that I myself, my own COVID has not been textbook, has not been textbook at all. So that's like a layer of uncertainty.
I missed that piece. I'm sorry. There's
so no
there's we're no one's immune to the virus, and no one's immune to the psychological consequences, the demoralization. But you're also pointing out there were some unique experience for you of some neurological consequences, that weren't described, and you're still trying to figure out.
Thanks. I feel fully heard. Thanks for that, Stefan.
Okay, thank you. Okay, so what I'm hearing now is
who are you speaking to?
I'm sorry. So I'll talk to Edwin.
Okay, listening.
Yep. So what I'm hearing now is no one is spared. There is no magic group to rely on who has not been touched, who has complete time and resources and is at their fullest thriving wellness.
So you're really hearing that everyone is touched by what's happening, and there's nobody that's like, totally thriving and, untouched by the stresses and strains of what's going on.
Mm-hmm. And I'm hearing that, the intent of this empathy circle today is perhaps not being met in the way that we set it out with the intended. But what we're finding is that that all of us are finding this helpful for and need the help. That what people are talking about today, this summer, my summary is that we're all hurting and vulnerable in different ways, and a great deal and most of this meeting has been about that, and that is beautiful. That's the purpose of the empathy circle, and that's why it's so powerful.
So you're saying that everyone is touched by this, everyone feels the strains, and that we've been sharing, and that's kind of the benefit of the empathy circle, is being able to share those, and that's the sort of the meaning behind what we're doing.
Mm-hmm. I think that maybe if under healthier conditions, the empathy circle could be used in a way that could be more of a planning kind of thing, like we intended it. But I don't think that's going to work right now. I think what we're going to have to do for the planning part, it's going to have to involve a more kind of a command center approach. So, I mean, if you look around the world at the people who have been effective in fighting COVID, it's people who have also have a centralized, very effective way of communication and assigning people roles in an organization or in a team, and people carrying out their roles.
Mm-hmm. So for effectiveness, what you're seeing is sort of a centralized command structure where there's sort of delegation, people have roles, people do the roles, and in this context, it's more of what's needed for what we're doing. Mm-hmm. Or that's what's effective.
So in the military, right, in the military, there is this concept called the force multiplier effect. That's how we I think or will help kind of spread that. The effect produced by a capability of a force, a combat force, is increased by the combat potential of the force, realizing that what you can affect and effect, what you can influence and what you control is you. And the team works because their collective effort multiplies results. And in terms of team stress, being a force multiplier is, balancing out what is happening in the moment, like what's happening now. And so the overall effectiveness of the group is increased by being present, and the actions that come out of that collective sense of action and sense of we, where we're all respected, but yet we recognize each other's accomplishments as we move forward with this project, and that we seek out opportunities to help each other reframe and grow in our our own in our trauma and in our experiences during this time.
Mm-hmm. So you're seeing sort of how we can have an effective team, and there's it's about sort of using this. I don't know if I quite understood it, but it's it's more of a command central, having assignments, tasks, and that there's sort of that we're in a team, and it's a mutually supportive team, and and compared to with maybe the empathy circle, kind of more of an open sort of a empathic process for contrasting that. I don't know if I quite got that.
Yeah, I mean, I'm just saying that that this in no way detracts from what the central benefits are of the empathy circle, but in terms of the planning piece, today has not brought forth the actionable deliverables that we were looking for, but what it has demonstrated is once again how effective it is. And I'll just highlight the two most important things I've collected from today. One is about how multicultural the world is, and how that brings up significant challenges for empathy, because you're about 10 to 20% less effective with empathy, when you are reaching across to different cultures and things, and because we heard from Jasmeet and both from Charles and from Charmin how they're from different countries, different nations, and there's all these other these cultural barriers that are on top of all the other barriers. And then just the last piece is that everyone's hurting right now in different ways and at different times. And that's why the empathy circle is helping the people in this circle right now.
So you're saying that the empathy circle is helping because people are coming from a lot of different cultures, and that this helps with that, as well as everyone is hurting. And so that's we're actually using the empathy circle to speak to those pains and have that support. And that was the time too. So we want to get back to the full group. So I'm going to close. So thanks everyone for taking part in this, and we'll just go back to the full group to
Thank you so much.
To report back what we're. So I'm just closing it. You can go back directly, or it'll send you there in 30 seconds.
Jasmine, you look confused. I guess you look very confused right now.
No, I know what it is. I am getting LASIK eye surgery, and they dilated my eyes. So it's just the light that's coming into the house.
Wow.
That's the only reason.
Okay, so great. That was sort of a taste of the empathy circle, because I think to kind of move forward in this team, we need everyone to know what it is that we're doing and how we're doing it, and to get some experience in the practice. So we just like to hear report backs on sort of next steps of, what you would like to do. What would you like to, kind of the steps you'd like to take back, maybe report on the group. I can give a report from what I was hearing. I was hearing a lot of concern that everyone has, that everyone is affected by what's happening. Your family, your friends, your health, your jobs, like everybody's impacted. It's like, and so there's a lot of concerns and worries about that. Some people were trying to reach out to bring friends into this group to kind of help build a team, and just kind of naming the challenges and kind of seeing how to overcome those challenges. And we did say that the empathy circle itself was sort of a healing practice. And I would sort of say that it helps with, kind of personal healing, personal support, as well as, for a group support. And so in terms of deliverables, I didn't mention it, but we can have like a training, do a facilitators training, so that we get everyone up to speed to know how to do this practice and kind of be good at it, be able to offer it. And then it's kind of easier to know how to kind of take on projects for it. So maybe I'll just call on people that kind of report back. Jasmine, would you? Or Sharman?
What was the question?
Oh, just kind of report back. Our question was, what are the deliverables? What tasks would you like to take on? So just kind of to report back on what you're seeing as sort of a next step.
Yeah, so basically what I was thinking is maybe, expanding on getting maybe more people to join us in the meeting. So maybe, I think Sharman had talked about it, maybe through like social media, and, maybe even giving out handouts at hospitals where, letting them know that that they can join a group to talk about things that are going on in their life at that moment. And that there is this meeting is open for everyone to join, basically. Like, spreading the word kind of. But yeah.
So reaching out, kind of bringing more people in.
I think that would be
methods, and you're willing to do that.
Oh yeah, definitely. And also, like, I feel like with more people, we would be able to get more ideas, more kind of people to take on different tasks, because I feel like since this is such a bigger project, it needs like a lot of people to take part in it. And basically, I think that would help a lot.
Okay, and then we also want to set up a facilitators training, maybe like an 8-hour training. Would that be something that you would be interested in taking part in?
Yeah, definitely. And I feel like kind of like a facilitators meeting. So before you know, these people are joining our groups, they would be able to understand the full concept of what would be going on during the 2 hours that we're together. And I think that would definitely, even for me to have that before I came for my first time, it would be awesome, because then I know what to expect.
There's
Today,
a learning curve to kind of take part. We want to get everybody up to speed.
Yeah, but definitely just these 2 hours today that I've spent with you guys, it's already kind of, you know, I've learned so much, and now next time I join you guys, I'll kind of know what's going on.
Great, thanks. Charles? Yeah.
Hi, and hi again, everyone. Well, that was my first experience. I should have mentioned that earlier as well. I was just very curious to see how these go. So thanks for having me, and I learned quite a bit. Now the question of how do we, what's the next step, and how do we reinvest that? I'm not sure I'm comfortable suggesting something along those lines yet. Maybe I would wait a little bit to see how this pans out. As I mentioned in our circle, that I have quite a bit on the plate now, that I just need to find a balance again. But when these events come up, like now was actually a very good time for me, so it's great timing. So I think I'll see how it goes after that. Of course, I think that a training is a wonderful opportunity. I think these circles could be open to, obviously have more people as well. So I would be inclined to spread the word. And if I can end on also a good note, participating in the circle itself, now that there's not so much unknown, it's quite a motivating factor to enact them. Once you broke the ice with that practice, then I feel myself much more inclined to lead circles, definitely.
Yeah, so just really taking part in it, you got to have that personal experience, and then you can kind of take the next step. And yeah, so okay, great. And you're interested in the facilitator training? Was that
so,
something?
I am for sure interested. And then about when it for 8-hour commitment and all of this, it's something I'll have to see when it's offered. I don't want to make false promises, but I'm clearly interested. Yeah.
Okay. Great. Okay. Stefan, do you want to?
Well, you know, I'm going to try to. Let me be mindful of everything that I've heard. Okay. What I'm looking for at a minimum is that before you participate, you know, right, in this particular, do not invite people to this group, okay, unless you have done the facilitator training, which is online, which takes 4 or 5 hours, that is already available, and you can do it. Now, there are many different empathy circles you can join. But I think what we have to do is we have to separate people who are learning the practice, and that's wonderful, and also benefiting from it. And there are many other groups you can join. But this one is particularly focused on the planning of it. So this group, so, you know, if you're interested in that part, the first thing you need to do is go do the training, because walking into this group without having ever done it, it's not what we need to be doing with this group. And I was just so happy to hear how everybody benefited today, and that just proves once again how useful this tool is. But all I'm saying is, for this group, we need to start moving with some actionable steps. And so this group, we need to circumscribe it to those people who, at a minimum, have done the training and are in a place where they're committed to actually participating in doing some of the action items to get this moving along. If you want to just heal yourself, there are group empathy circles for that, and there are other empathy circles that Edwin has already created a platform where you can practice the facilitator skills. But this specific group is for the next steps in planning how we're going to implement the empathy circles specifically in the healthcare.
Oh, great. Thanks, Stefan. Divya?
So yes, I definitely want to be a facilitator. So I am going to be attending all the facilitator training meetings. With regards to how we can, what's the next step? I am really not sure what the next step is. Like I said, we do need to spread the idea of the empathy circle to more people and kind of invite them to the appropriate groups, like how Dr. Carlson mentioned, once they go through the training videos. Apart from that, I'm really not sure what more that we can do. I'm ready to help in whatever way that is needed, and I'm looking forward to hearing your ideas.
Okay. Thanks, Bill.
Well, I was, hearing the people getting the benefits and also wanting to know about next steps. I think that Edwin's video trainings are excellent. I think, but the empathy circle is experiential. And I believe that it would be helpful to go through kind of an experiential facilitation where you're kind of talking about facilitation and learning about it at the same time and having that experience. Just to let you know, I put in a link to a possible, not, it's rough, but a possible facilitation training. And I'm ready to do that whenever. It may need to be tweaked or cut down or whatever like that, but I'm ready to, to jump in with that. I feel that would be ready. And if people like it, check it out. I have the link to it. You can check it out. Thank you.
Thanks, Bill. Martha?
Yeah, I hear Stefan's wish to have a team and have something implemented and have it working and scaled up soon. And I also hear that it's important that people build have training, that they join that training when they feel ready, once they've participated in, today we did 50 minutes, like a normal empathy set will be an hour and a half, just the circle part. And that's quite a different experience. And so, I've put the link there for full-length empathy circles in the chat. And so it's, that people experience the empathy circle, they feel they want to facilitate it, they do the training experientially, not just watching the videos. They build a team that they feel really comfortable with, and then they choose a project that aligns with what they personally feel like offering, and that they feel comfortable with, and that aligns with their own ideas. I think, yes, the healthcare needs it. I'm worried a bit about having it implemented in a workspace, because the moment it's part of your duties to do this, rather than in any moment it being your free choice. I think it brings a different element, but maybe just as long as people feel free to talk about that, then it should be fine. And it's, everyone wants to contribute, and so we're here to help people find the way in which they can offer that as well, and so they feel comfortable and they feel secure in doing that. Yeah, thank you.
Good. Thanks, Martha. So this was really our first sort of meeting to kind of form this team. So we're kind of seeing, who wants to join, how do we connect with people, how do we get them on board. We do want to have it, I think, like you're saying, Stefan, a task oriented, like, what tasks do you want to take on? But we do have to find the people who are willing to kind of come on board. We've done a lot with volunteers, so it's really hard to do command and control with volunteers. Maybe in a hospital, it's like, hey, you're a student, you're interns, you're getting paid here, go do this or else. And we can't do it. It's like we have to kind of motivate people to kind of want to do it and be self-motivated. And so that's a little bit, we're putting it out there to, kind of find people. There is not all these, like, Charles has been working, for quite a while in empathy. I mean, doing a master's, whatever. And then there's a lot of people there, even within the empathy community, there's not a lot of people who have done empathy circles, you know, so we need to bring people up to speed to be, it's hard for them to take on the task unless they're kind of familiar with what we're trying to, what and why.
Right.
So I'm just trying to think of, you know, how do we, I love being effective. I do, you know, do a lot of, you know, but it's like how to be effective. So I guess that's just kind of things that are coming up for me. And also we meet next week too, but we can kind of talk about how to, you know, take next steps in between. I'm going to be reaching out to the different communities that I know of and asking how they'll support it. And yeah, so that's, I don't know, any final thoughts, Stefan?
What I, you know, there, you know, the wonderful thing that all these networks and different groups you put together, it's really something amazing, and I'm always impressed by it. You know, what I think for this particular meeting in the future, we should keep it to a small group of people who have, you know, already decided that this is something that they're willing to commit with. I understand that everyone has their own individual projects and interests, and that's fine. You know, but that's not this one group's meeting. I mean, purpose, I think.
Right.
And so just in terms of actionables, I don't know if you're available at 4 p.m., but I'm meeting with a guy named Stephen Murray, who's the like the CEO of an organization called PsychU. And I told him that you, me and this mindfulness guy, John Aaron, would like to do a webinar on their national forum, which goes out to all psychiatrists and psychologists, talking about the empathy circle and about mindfulness and how they are both these scalable interventions that can be used in, you know, in disasters or in crises, and you know, and they have the pure benefits of it. I don't know if you're available at 4 p.m.
Yeah, I am.
Today.
1 p.m.
Okay.
my time.
And, you know, and then, you know, I mean, the things that, you know, particularly this group are going to need are, you know, still, we need someone to help us put together our RB proposal, someone to take the lead on training the facilitators up to lead the groups. And as you said, you know, there's the kind of the marketing, the website, the you know, the social media piece of it, and you know, so there's a number of different pieces, and I think at least the people that you know, that, like you said, that were doctors that have worked with me, I think that they will you know, be able to spend some time. You know, they also are themselves stressed and have all things going on, but I think that they'll be able to commit some particular amount of time to the specific tasks that are needed. They've all said that to me to some degree, because it's something that they feel that they can benefit from. So the final piece of this, I'm just hearing over and over again, is it's a constant struggle between the I and the collective. You know, there's the I that has to do this and the I that has to do that. And there's this sense of we that is developed in the empathy circle. And we're always struggling with that I and that we. And there's nothing, and it's no judgment. It's just, that's how life is, you know, at any time. And in fact, you know, part of what the empathy circle helps us develop is our own healthy boundaries. You know, when we say yes and when we say no to, you know, involvement and such. But what I'm just trying to say right now from a non-judgmental perspective is, beyond just helping yourself, you can help yourself other places, and you can pursue your own projects other places, and you may learn. But with this particular group, I'd like it to be more mission focused in you know, moving forward with the next steps, and that requires someone to say that they're committed, and someone to have you know, at least a basic understanding of the empathy circle and how it can reach the goals that we're looking for.
Okay, great. Well, that kind of helps create the contours, kind of the expectations for this group, and then we meet again next Tuesday, and we'll see if if something comes up in between too. We can have some other, and I can definitely
I'm sure
join
it
you
will.
for that call.
I'm sure it will.
So yeah. So,
Okay, so I'll call you about that.
okay, great. You'll send or an email just with the link, or is it a phone call or whatever?
I'll call you.
Okay.
And I just want to thank Marta. Marta has brought up so many excellent points. I want to thank Bill. I think Divya for joining. Today is Jasmine's first day. This is Charles's first day, and I welcome you guys to try the empathy circles. Edwin's been doing them for many years, and I value them and found great benefit from them. And I hope you will too. And I hope you'll stick with it,
Likewise, yeah. Friday we have the links. It will be in the event, this event page. There's links to the other circles too, or you can email me directly for any info. Okay, well that's it. Then we'll thanks a lot for Look forward to the next steps.
Really nice meeting all of you.
You too.
Pleasure.
Thank you.
Forward to working with you guys.
Great meeting you, Charles. It's good to actually connect with you.
Likewise.
Good to
Edwin.
see another person interested in empathy, so that's another empathy enthusiast,
Let's have a
self-motivated.
Let's have a talk together sometime and expand on empathy itself and how we make sense of it in practice. That would be great. I do all these interviews, so we could have sort of a mutual interview. We'll record it and post it or something if you're up